Carbetocin. Carbetocin, as we all know, is used for prophylactic management of PPH. PPH is a condition which can lead to disaster. While there are several papers and guidelines which suggest use of Carbetocin, we have eminent speakers with us to give insights on their own clinical experience with Carbetocin. Today we have Dr. Shamalee Sarode with us to give her insights on this. Welcome, madam.
Thank
Dr.
you.
Shamalee Sarode is MBBS, MS, OBGY, obstetric gynae, DNB, MNA, MS, fellow in reproductive medicine, director and consultant gynecologist, Arogyam Women and Child Care Hospital. Her experience includes fertility treatments, pregnancy care, and menstrual health management. Madam, welcome to this webinar.
Yeah, thank you so much.
As I said, there are many papers which talk about the Carbetocin. The first question I would like to ask you is, what is your experience with Carbetocin, which is more important to the practicing doctors?
Yeah. In my practice, at least, I use Carbetocin prophylactically. That
Correct.
I don't wait for PPH to come and land up in that situation.
Yeah,
it is
correct.
very disastrous situation.
Yes, correct.
So I use it prophylactically, for each and every patient, whether she's a normal delivery or whether she's a cesarean section. I do use Carbetocin.
That means, if you would use Carbetocin in all patients, irrespective of whether they are vaginal or cesarean.
Yeah,
whatever.
definitely.
Yes. That's right. And okay, so with that, you are able to prevent most of the PPH.
Yes.
Correct. So, you have already answered this question.
Yeah.
Is there a specific patient profile where the doctors can anticipate PPH? Like, we say PPH is one thing which is expected, unexpected. Any patient can get it at any point of time.
Yeah.
But is there some patient profile where you can, predict, or you can say that PPH can happen?
Yeah, we can anticipate PPH in if there is a prolonged labor, or if there are multiple gestations. And many of the times with the IVF practice going on, and the multiple patients are confronting with the problems of infertility, multiple gestations has become a very common thing nowadays. So many of the multiple pregnancy patients, they might land up in PPH because of the large uterus and the hemodynamic conditions. So there we can anticipate PPH.
And madam, there are many young people getting diabetes today and hypertension. Does diabetes or hypertension predispose to PPH, or any correlation?
The comorbidities, they definitely add up to that situation.
Yes.
But per se, diabetes will not lead to a PPH condition, but a hypertension condition can have a little bit of connection with the PPH. Because the blood pressure is so high that all the sinuses, the placental sinuses, the surface oozes out. It is very difficult to describe that situation.
Absolutely.
But then, the PPH, then it can happen. So
those situations are nightmare. Yeah,
it's a nightmare. So we can use Carbetocin.
And this fibrinogen and this clotting factors problem will definitely predispose. That's a given thing.
Yeah, definitely.
Just a random question. Is PPH more common in cesarean section or normal delivery, or nothing like that? It can happen anywhere.
Nothing like that.
It
can happen. Yeah, it depends on the condition. If it is a normal delivery and if it is a prolonged labor, and then it can happen in the normal delivery also.
Fibroids, uteronectomy.
Yes.
Would you prefer Carbetocin or oxytocin for prevention of PPH? You have been preferring.
I'm routinely using Carbetocin as my first line of drug. Even if we use oxytocin during the labor induction, or even then, I use Carbetocin as my first line. Whenever the baby is out, immediately I use Carbetocin.
And oxytocin is our textbook brand, which I have read in our textbooks.
Yes.
In case of retained placenta, would you use Carbetocin?
Ideally, we should not use Carbetocin in case of retained placenta. once the placenta is out, then definitely to
Yes.
avoid the PPH or the conditions like that, so we can use carbetocin after removal of the placenta.
And for retained placenta, the ideal treatment is, of course, removal of the placenta. Maybe
Yes.
maybe surgical,
Yes.
maybe yeah.
Yes, definitely.
And after that, also, if PPH occurs, straight away using
Yeah, straight
carbetocin.
away we can use single dose of carbetocin.
Carbetocin to prevent PPH.
Yes, definitely.
This question has been coming across the country. Can we use carbetocin in RH negative methods? There are no specific
Yes,
studies.
definitely we can use. No issues.
Because here it's very important that, I mean, the antibodies and etc. Should not.
Yeah. But the thing is that whenever there is an auto transfusion, that can occur with any kind of uterotonics.
Okay.
Basically, RH negative pregnancy, we definitely avoid methyl ergometrin, but carbetocin can be safely given.
Methyl ergometrin, any specific reason?
Yeah, in RH negative pregnancy, generally methyl ergometrin is not given, so it is contraindicated in that condition. Yeah.
Any specific reason? Just for my.
Yeah, just auto transfusion is more in case of but oxytocin and carbetocin, yes, because it is an oxytocin analog, so we can use it. Yeah.
In fact, you have already answered this. Can a doctor, you have been using this, can a doctor use carbetocin for prevention if oxytocin used for labor induction? Labor induction, everyone uses oxytocin. Most of us use.
Yeah. That's what I was saying, that I use carbetocin, even if I have used oxytocin for the labor induction. Yes.
I suppose one differentiation is that for carbetocin, you don't require a drip, IV drip.
Yeah.
For oxytocin, you require. I mean, talking about the interiors, that could be an issue. Secondly, the cold chain matters. And a single injection will always be, easy to give. Especially I'm talking about the interiors where medical help, we do not know how much medical help people will have.
Yes,
definitely. This is very common in our, a place, the interiors. That's a place where I suppose carbetocin could have a little edge over oxytocin.
Yeah, definitely.
And another thing that is happening is that even if people have refrigerators, I mean, this is happening in Mumbai also.
Yes.
Power outage, refrigerators. Yes. So yeah, that's another.
Yes.
Is there any place specifically where you prefer IV or IM route?
If there is a multiple gestation, if there is a preterm labor occurring, then we can use the IV route to have more urgent effect, you can say. Because the IV route is definitely acting first, and then the IM.
Yes. IM route will have a longer duration of action, possibly where you want a longer duration of effect. You would use.
Yes. IM. Yes.
Otherwise, IV route is the preferred route in those cases.
Yeah, it is the preferred.
If patient is not responding adequately with carbetocin, which can happen, what other additional uterotonics that can be used?
Yeah, depending on the patient profile, if carbetocin is not working, then we can use methyl ergometrin. If the patient is anemic, or if the patient is having any heart condition, or her BP is high, that means preeclampsia cases, or RH negative pregnancy. In that cases, we need to avoid this methyl ergometrin also. In those cases, we can use carboprost, prostaglandins. But again, the asthma is one of the conditions where we again cannot use carboprost.
Prostaglandins.
So again, we can use per rectal mesoprostol tablets. Yeah.
This is how as supportive carbetocin doesn't work. But how frequently has it happened?
Supportive to that. Supportive to the yes.
How frequently has it happened? Carbetocin not working?
No,
not working adequately.
I am very happy with the carbetocin because touch wood, but I haven't come across the postpartum hemorrhage case in my practice. So touch wood to that. But the carbetocin acts wonderfully. Yeah.
You'll agree with me. PPH is a case which is so one in PPH is wonderful to discuss and write papers, but one should never get a case of PPH.
Yes, definitely.
And if some drug not responding, it is still a disaster. What is the advantage of carbetocin over other uterotonics like oxytocin? I've already said misoprostol, carboprost, or methyl ergometrin.
Yeah. The Carbetocin is basically it is having a long acting action because the half-life of Carbetocin is almost
Yes,
42,
yes.
approximately 42 minutes. And whereas Oxytocin is having only 5 minutes half-life. So definitely Carbetocin has aged over
Your
the
voice is breaking, madam.
Oxytocin.
Your voice is
Again,
breaking.
the thermostable that thing. Am I audible now?
Yeah, now it's okay.
Yeah, yeah. So, as I said, that Carbetocin half-life is good. So, a single dose, long acting, it can act wonders, and even thermostable conditions.
Yeah.
And again, as I have mentioned, that misoprostol and carboprostol we cannot give in asthmatic patients, like methyl ergometrin we cannot give in
Hypertensive.
hypertensive patients. So definitely Carbetocin has an advantage over there.
Carbetocin as compared to oxytocin or other these neutrotonics, is the intensity of contractions is the contraction more intense with carbetocin?
In the initial phase, 1 or 2 minutes, it is having a sustained contraction.
Okay.
And after that, it increases the biphasic contractions also, and rhythmic contractions also it increases.
Increases.
It increases the frequency also, and it
Okay.
increases the intensity also.
Intensity also. So,
Yeah.
So all in all aspects, more or less, carbetocin has an edge over oxytocin, misoprostol.
Yeah.
Of course, I'm not saying 100%. There will always be plus minus. Oxytocin,
Yes.
misoprostol, carboprostol, methylamitol, and we sincerely pray that none of the doctors, attending get a case of PPH.
Yes, definitely.
Yes. Now, this carbetocin, should it be kept as a reserve drug or should it be used as a first line?
At least I can proudly say that I am using it as a first line drug. So, as far as I'm concerned, that I'm using it as a first line. So,
and looking at the potential, what it can do. I mean, if it's not responding to PPH. At many places, what happens is that cost is a constraint, or there are government.
But then, if the PPH occurs, then the cost is also like the multiple
immaterial. It's immaterial.
Yeah. Sometimes we need to do the obstetric hysterectomies also for that.
Yes.
So, considering all these factors, I think the cost of Carbetocin is very small, I think.
Yes. I mean, you look at the potential, what can happen, disaster which can happen, one can try to avoid it by using prophylactically.
Yes.
So if are there any specific contraindications of Carbetocin?
Very less.
Or adverse effects, if you have seen, since you have been using it in almost all patients.
Yeah. As of now, I haven't seen any serious side effects of that. A little bit of pruritus or something that is fine. But even the hypotension causes not. Hypotension I have seen more with oxytocin and less with Carbetocin. So yeah. So I haven't seen many of the complications with Carbetocin, and
Would you avoid giving Carbetocin to any of the patients? Contraindications?
As per the literature says, it has contraindications in some renal or hepatic conditions.
Yes.
But then at that time, I think the life is more important. So sometimes it has age over the other drugs.
Have you seen this ADH-related adverse effect with Carbetocin, which is commonly which happens with oxytocin?
I haven't come across.
You haven't come across.
Yeah.
And with oxytocin, have you seen any time?
No.
How would you conclude, efficacy-wise, safety-wise, tolerability-wise, or take-home message, Carbetocin versus other neutrotonics?
My take-home message will be like it is better to avoid PPH rather than we need to accept the things even though the oxytocin is a textbook thing, and we have all come across and we have heard about oxytocin, but trust me, I am using it for each and every patient.
Induction,
And
yes.
I have
Second stage.
best results with it. So that take-home message is only that we should use carbetocin if it is giving benefits to the patient. If it is avoiding PPH, then nothing about a specific drug. But if it is giving benefits to the patient, then we should at least have a trial of it. You try it first, you have your own data, and then you can use it.
Which is why we said, irrespective of the textbook recommendations, a doctor's
Yeah.
experience is a doctor's experience.
Yeah.
This is first-hand experience, which our doctors would always like to, listen to. The people who are already
Yes.
practicing their
Yes.
experience.
Yes.
Which is
Definitely.
why we have kept this webinar, to share experience.
Yes.
That is all from this one. I'll stop sharing. Thank you very much. It was lovely getting your experience, sharing your experience.
Yeah.
And
Thank you.
yes, because as I said, experience is experience. Ultimately, it's never documented.
Yes, definitely.
Yes. I thank all the doctors who took time from their busy schedule and commitments and attended this program webinar. Also thank marketing team for conceptualizing and making it possible. Thank you IT team for your IT support. And last but not the least, thank you field personnel of Hetero for making it possible. Without field support, I mean, it is very difficult. So thanks once again, all of you, and signing off. Thank you, madam, once again.
Yeah.
Thank
Thank you. Yes.
I wish you a very good evening.
Thank you. Same to you.